Brian Mifkin from Hattiesburg, Mississippi. We're here at ASDIN 2025, Grapevine, Texas. Dalia?
I'm Dalia Dawood, Riverside, California, and we have the two chair of the ASDIN Research Committee who's going to introduce themselves.
Well, my name is Karthik Ramani. I'm the Medical Director of Vascular Access Service at the University of Michigan, and I'm BFF with my Research Committee Chair.
I'm Ziwei Tan, and I am a vascular surgeon for Los Angeles. Thank you for the invitation to do this interview.
So let's start by asking Dr. Tan, how many years you've been attending the meeting so far?
So I have been attending the meeting since I graduated my fellowship. So more than 10 years, I think.
And Dr. Ramani?
Since I was an embryo, just like Dr. Saad mentioned, I've been here since actually as a general nephrology fellow and then beyond, and I've seen it kind of explode into what it has become right now of this beautiful meeting of minds as well as technology.
Yeah, so that was actually my next question. How did you see the meeting progressed over that many years?
So I think this is a fun meeting, and I think it is a great job. The program chair did a great job trying to keep the meeting interesting, engaging, as well as beneficial for people who is practicing or also doing research in vascular access.
What area that you would like to see more in a meeting, like research? Obviously, you would like to see more research, but what other area? Legal discussions, in industry discussion. What else would you like to see?
I think I'll take that one first, Dr. Wei, is that, I think we like to see a 360-degree meeting. What sets us apart from the other meetings which are there on vascular access in general. So 360-degree means definitely the burning clinical questions which are there that need to be addressed. Second is definitely in terms of research. How are we pushing the paradigm? As Dr. Sachdeva, the president of ASDIN, mentioned, we're a beacon of hope, and we're a beacon of hope for access care. So that's important. Third is education. So building for the next generation of interventionalists, that is critical. So having this three-way, 360-degree approach to meetings, I think is critical for ASDIN's overall success.
And to build on that, I think it'd be nice to have more mentorship component put to the meeting. So, encouraging the students, trainee to come to the meeting, mentor them for clinical practices and research, as well as even junior faculty to advance in their career.
What, in your vision, thinks the best way to advance the research section of the meeting or ASDIN in general? What is the barriers that you have been facing to push or enhance the research part of the meeting or ASDIN in general?
Dr. Wei?
Yeah, I think there are a lot to talk about. And one area I want to highlight is there's lack of multi-center study or registry to kind of highlight the outcomes, talk about challenges, what we could do to improve the practice, process, outcome, cost for vascular access creation and maintenance.
I think I want to, again, add on to that and say that just like ASN created a kidney health initiative, we're working with the FDA and other industry and regulatory partners. I think ASDIN is that voice for interventionalists where we can partner with industry to do industry-sponsored research and highlight that, work with regulatory agencies so we can have faster throughput of good quality clinical studies. And at the same time, we need to have a multi-pronged approach to research in general where we allocate more resources, more finances, and such events in the social media space such as ASDIN TV to highlight the value of research in general. So research is not just for academicians, but research is to provide the scientific basis for advancement in general.
Brian?
Can I add something? I think we have done a lot of work to highlight the contribution in research, particularly for our international members.
Yeah, that's a good point.
I think it would be nice, to have the resources to make this the premier meeting
Excellent point.
for vascular access surgeon, interventional nephrologists, radiologists around the world to come over to present their work, highlight their achievement, collaboration, and then, just have a good time.
Actually, that's a very great point, because this meeting is about collaboration, and definitely we would like to see more vascular surgeon and more interventional radiologists. It actually was amazing today to hear Dr. Bethard when we interviewed him early today, that he said that as the founder of interventional nephrologist and subspecialty, he feel now he would like to change that from interventional nephrology to dialysis access care to be more inclusive to all of the stakeholders, including interventional radiologists and surgeon. Brian?
Yeah, and so as you guys have said, there's been a lot of barriers to doing more research, that a large number of our members are private practice, and so maybe they don't have the same incentive to do that type of research. But it is important, because we want this meeting to be more than a this is how I do it type of thing, right? We want the numbers, we want to be able to present things to other groups as we advocate for our patients, that we have the data to back it up. So we need to continue to push for that. But in terms of collaboration, which this year's main theme is to collaborate, we got the surgeon here, we've got an interventional nephrologist. How do we get more people interested in this conference? How do we get the mid-levels and people all across the spectrum who are taking care of dialysis access?
Yeah, I think you definitely need a multi-pronged approach. But the theme, in addition to collaborative care, I think we have to add one word: collaborative patient care. So the patient being the primary focal point for the meeting, and for the surgeon, and for the radiologist, or for your friendly neighborhood interventional nephrologist, I think is critical. So having that focal point, and then having the policymakers kind of chime in. So you kind of going to the policymakers and kind of asking for policy changes, which would be important to garner that kind of support and collaboration, is I think critical.
That's an interesting point. Should we have more of a patient voice here?
I think for sure. Without the patient, we are no good. And so the patient gives us the strength to do better and become bigger.
Yeah, I want to build on that. I think, so we talk about the private practitioner does not have any incentive to do research. That might be true for translational or basic science research. But research is really, really broad. So one of the areas that we could potentially highlight is to report the outcome for a multidisciplinary vascular access team. So we have a lot of data for cancer care, limb preservation, and although we know the value, but no one put the data out there to highlight the contribution for a multi-specialties, including doctors, nurses, administrators, patients, in contributing to the optimal outcome and care for these patients.
I think it comes back to this, Brian. I think that all of us should hold hands and make a pact saying that we got to speak to the powers that be and say, hey, we got to make research great again.
Let's make research again. So, I mean, I know I attended the council meeting with Dr. Ramani when we were going over your committee, and you mentioned some about resources, how to have, because you really need a fund. So is there any suggestion or in your vision, how can you overcome the funding barrier when it's come to research?
Dr. Wade, do you want to take that? Well,
yeah, I think that's a tough question, especially in this environment, and really timely questions. I think getting any grant from government or NIH or NSF is going to be challenging now or going forward. So I think this is more about getting buy-in from our stakeholders. So it could potentially be a foundation, non-profit foundation. It could potentially be from company, trying to support our endeavor, and then maybe as the form of a grant to ASDIN to support the stuff that we talk about. And one potential project that we could talk about would be a registry comparing new technologies such as endo versus open fistula creation.
I think that's a great point. And there are so many opportunities is what Dr. Wei is trying to highlight. And I think my point again is going back to that patient. So if there's a burning patient-related question, so like this month is heart-related month. So there's a lot of cardiovascular research into heart-related events because sudden cardiac death is such a big event. Breast cancer research, huge push. Obesity, for the first time it has plateaued. Huge push in research in that. Similarly, they need voices such as these to highlight the problems of the patient. And what a better voice than the patient themselves. So highlighting that will garner some of the resources, whether it's industry, whether it's government, federal, whether it's local, intramural, institutional, foundational grants. But we need those resources to mobilize the forces that are needed to provide good scientific evidence to bring about change.
Now, that's very well said. Thank you, Dr. Ramani. Now, to do research, you need the funding, but you also need the manpower. Do you feel that the new generation of fellows have like the passion to do research as the earlier generation? We just discussed that generation different with Dr. Ross, who acknowledged that we are in a different era with a different generation. So I was wondering if you observe difference in the new generation and their interest in research.
I think I'll leave the question for nephrology fellow and internal medicine resident coming through.
But even surgery, like
I think the newer generation has less interest in the traditional research. I think there are many other way of research activity that could, report important results or, sharing perspective from patient and, advocating for the dialysis care. I think we need to get their buy-in, I think, and be innovative about the way that we report these results rather than traditional, peer review publications. And there are many things to do. I don't think that is a problem at all.
But I think it's a very tough question to answer, and it's a multi-layered question because the research does not provide you quick returns. It takes a long time to get those returns. So you may start off as a medical student or even before that as a pre-med starting to do research, and you may not even see the light at the end of the tunnel in terms of that research being published. So that creates a lot of disillusionment among the new generation who are used to quick fixes like a TikTok video or like a YouTube video or a 10-second snippet. So this is where I think we need to repackage, rebrand research in general, just like we have to reevaluate how we're doing intervention in general. We need to repackage research which can potentially provide, with the appropriate resources, quick returns, which are still scientific, which will engage with the audience, and our audience here being the young researcher, and which will tell them, hey, you're making breakthroughs rather than getting into breakdowns.
I agree. This will be, of course, a good approach to make them feel that they can get the reward from their work. Brian?
With trainees, the issue is when they come out, you want to do everything, right? You want to do research, and you want to do your procedures, and you want to do the office, and everything has a cost. So that's what I always tell them coming out is, if you want to do research, that's great. It should be something you're passionate about because you are going to have to pay a price in time and effort to do that. But it has to drive you. You have to want to do it.
And I want to take this chance to highlight the resources that we have for ASDIN. I think there are many things that we can support research activities from ASDIN standpoint. We have the pre-existing mentorship research program that we provide sustainable or connect the trainee with experienced researcher to provide guidance. We have multiple small to larger grant in the form of vascular access research grant that provide $25,000 a year to support a small or ideas to build prelim data for larger funding. And we have the smaller support such as the manuscript editing services that we can help for people that are starting out to familiarize themselves with the process of publishing, writing an abstract, going through submission and then publications.
I mean, these are very, very important points for the listener to hear, because we have provided all these resources, like Dr. Wei has mentioned, so that we encourage the new generation that to come with us and to say, hey, you're not alone. We're here to walk the path and walk the talk with you because of the resources Dr. Wei described. So I don't think that it's a light at the end of the tunnel. I mean, I think there is light at the end of the tunnel, rather. And I think that we should recognize ASDIN for doing that, and also Dr. Wei's leadership in making sure that we're able to achieve this. Not only the leaders of ASDIN, but leaders such as Dr. Wei to move it forward as well.
And I think most importantly, ASDIN is a good platform for new researchers to present their work. We welcome any submission, any great ideas. We will provide you with a platform. We will encourage collaboration. And then most important thing is we encourage interaction with more senior researcher, experienced practitioner, so that you can take the next step in whatever you're interested, including in research.
Okay, so Dr. Ramani.
Yes, sir.
You are the godfather of ASDIN TV. So all these messages are great, and we want our message to go out very far, and we want lots of people to see it.
Yeah.
Where do you envision that these videos should be, that we can get a good audience for ASDIN?
I think it should be all over the universe, and by that I mean Mars as well. But no, honestly, I think you're very kind to say that. But as far as, I mean, if these videos can go everywhere, internationally, nationally, and be universal, because we want to, intervention, the I in intervention is inclusivity. So we want to promote all the word, the messaging about all the great work that ASDIN is doing, the opportunities that are there for the people, whether it's your trainee, whether you're a researcher, or whether you're a wannabe interventional nephrologist, to participate. So to answer your question in short, it should go as far as the eye can see.
Okay. So I just want to ask you, the research section of the meeting. So if you want to give a message to the next chair for suggestion about the research, what would you say? Are you happy with the research section, duration, location, presentation? And this is always for improvement. So if you want to talk about that or share about that, will be great.
Since I am the next chair of research, I would let again Dr. Wei chime in as to how he did such a beautiful handoff, and in terms of messaging, and then I can also chime in for the next incoming chair.
Yeah, I think from research perspective, we would like to have more time highlighting the projects for all the people that submit their hard work to this meeting. Although we provide a good platform, we could do more. We could have more time dedicated to research rather than one session. We could highlight different people, such as international members, our trainees, or even junior faculty, and make this the platform or the go-to meeting for them to present their work.
I agree. I can't agree more. I think there is, as I started this conversation, I think there's an opportunity to make access and research great again. And research is that foundation which sets us totally apart from other meetings which are procedure-based meetings and procedure-based societies. So we need to make sure that us provide, that is ASDIN as a society, provide the resources, provide the forum to showcase our work so that it can automatically have a feedback loop and create more research and more throughput and more interest and more eyeballs in research in general. But I want to take a moment to thank both of you as well, because you've done a tremendous job in kind of spreading the message of not only the research committee but of ASDIN in general, which is very, very critical for all our stakeholders at large. And those who want to join ASDIN, please do so, and please participate and be a part of the research committee as well.
Well said.
Wonderful. So this is actually was the conclude. Like I was going to ask if you both gave a statement to our audience around the globe, because we hope that this will be going around the globe. So that's very well said, Dr. Ramani. Dr. Will?
No, I think I kind of highlight this in the past too. We want to make this the meeting to the go-to meeting for you to present your work. We want to support you. We want to provide a platform for you to come and present your work. So don't hesitate to join ASDIN. Don't hesitate to submit the abstract. We'll make sure that you get recognized as long as you are submitting great work to our meeting.
How this meeting did impact your life? Being an interventionist and being in this meeting for so many years since you were an embryo, as you mentioned, Dr. Ramani, I would like to switch gear to that before we let you go. I want to know the personal side, how this has impacted your life.
A tremendous question. I'm still an embryo, by the way. I have not cut the umbilical cord either from my mom or ASDIN. And all I can say is ASDIN has been very maternal in that way in terms of support, in terms of providing the resources for my own personal growth. But in addition to patient, I think what is very, very important in ASDIN, which sets it apart, are the people. So networking, collaboration, growth, all of that brings me back to ASDIN year on year. So I'm very thankful and have gratitude to ASDIN in general and to those who are sitting next to me for my own personal growth and professional growth.
Yeah, I think I really appreciate ASDIN because the very, very first grant that I got when I started out was the vascular access research grant.
Wonderful.
And that really helped me start building my research program and then generate prelim data and help me go to take the next steps to larger grant, including from the government. So I think I really appreciate it to this society for supporting my research career.
No, I think I want to add on to that because it brings my memories. So sorry for carrying on. But since right now, I mean, how life falls full circle, right now we're judging abstracts. I remember my first ever abstract presentation many, many years ago for ASDIN. And I was in the hotel room vigorously practicing what I should say, what are the kind of questions to expect. And I was sweating tremendously. And I think it was in Vegas, so it didn't make it better in any which way and manner. But going from there and learning and growing is what ASDIN is about. So thank you for kind of tapping into those memories for me as well.
So you've completed the loop, and we appreciate all your efforts that you're doing to encourage research. We need more research for ASDIN to have that information to present so that we can really advocate for our patients.
Thank you. Thank you.
Thank you for your time today. It was a pleasure interviewing both of you. And
I offer Dr. Ash for your next
yes, absolutely. We will be
to talk about
yes,
research
absolutely.
in ASDIN.
He's one of the founders, so absolutely. But thank you so much for your time, and good luck with all of your hard work to enhance the ASDIN research committee. Thank you.
Thank you.
Thank you.
everybody.
Thank you
Thank
both.
you so much.